Good morning, everybody. We are almost ready to start this morning's proceedings. Can I just remind you that members of the public and reporters in the hearing room are not permitted to use any electronic devices during the hearing. If you wish to do this, you can do so in the annex. Legal representatives, please remember that though you are allowed to use such equipment in the hearing room, you may not transmit anything to the outside world until 10 minutes after it has been said or displayed. These are important requirements which are the subject of the Chair's ruling and a restriction order. The Chair may also make further restriction orders during the course of evidence. Breach of such orders is a criminal offence. Please also remember to make sure your mobile phones or any other electrical equipment you have with you are on silent mode. For those viewing in the annex, you will not receive any information until the 10-minute period has elapsed, so you may transmit information as soon as you see it. No food or drink may be consumed in the hearing room except for the water provided. Those people seated in the public gallery may not cross into the legal team area. If there is a need to pass a message to anyone in that area, please write a note and give it to one of the ushers who will deliver it for you. The usual sitting times for the inquiry are 10 to 4:30 each day. Lunch will be approximately 12:45 to 1:45. There will be short breaks mid-morning and mid-afternoon. Please wear your lanyards and passes at all times within the building, and note that if you leave the secure area of the building, these will need to be handed back. On re-entry, you will need to undergo a further security search, so time will be limited. Also, please remember that those viewing proceedings in the annex will still have 10 minutes of the hearings to go when we finish in the hearing room, so please try to be quiet in the entrance lobby when you leave. Our ushers are here to help you, so please ask one of them if you have any questions. Some of the evidence to be heard in this inquiry may be upsetting. We do have volunteers from the Coroner's Court Support Service who are available for confidential discussions if anyone is affected by anything said or shown during these proceedings. Perhaps the support workers could indicate where they are. There we are, up the back there. Please go directly to them or ask an usher if you need to make use of their services. I have also been asked to remind everybody that we will be moving to level 2 evidence later in the day, over lunchtime, I expect. Under level 2, the public gallery will be closed and only a few accredited journalists will be allowed into the hearing room whilst evidence is being given. Everyone else will be able to view proceedings in the annex, subject to the 10-minute delay. No one, whether a member of the legal team, an accredited journalist, or members of the inquiry staff or contractors, will be permitted to bring a personal electronic device into the hearing room. This includes mobile phones, even if switched off. The inquiry security team will be able to arrange safe storage of any such devices during level 2 hearings. If you wish them to do so, please ask at the security desk. And also remember, you must allow sufficient time to arrange safe storage for your devices before the start of proceedings. Thank you very much.
Yes, Ms Whitelaw.
Good morning, sir. Before we start with the first witness, you'll recall we left the evidence yesterday with PC Collins and that he referred to other officers of Wiltshire Police attending the scene of the Skripals at the bench.
Yes.
Another police constable in particular and another acting sergeant. With your permission, I'll adduce those witness statements and they'll be published on the inquiry's website. They are the statements of PC Alexandra Way, which is INQ 004966 and INQ 004973, and their statements of the 5th and 13th of March, respectively. And Acting Sergeant Tracy Holloway, INQ 005682 and INQ 004965, statements of the 5th and 11th of March 2018.
Right. Thank you very much. Let that be done.
And then this morning we have Mr. Ian Parsons giving evidence. If you could be sworn, please.
Would you like to stand and take the oath, please, Mr. Parsons?
I do solemnly, sincerely and truly declare and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Thank you very much. Do sit down, Mr. Parsons. That's how the microphones are set up.
Thank you, sir.
Questions will come from over there.
Good morning, Mr. Parsons. My name is Francesca Whitelaw, and as you know, I'm asking questions on behalf of the inquiry. Thank you very much for attending to give evidence today. Could you give us your full name, please?
It's Ian Michael Parsons.
You should have in front of you, I think, 2 witness statements you made. Could you just turn those witness statements up? The first should be dated the 9th of March 2018, and the reference for the transcript is INQ 004478. I'll refer to that as your first witness statement. Have you had a chance to look through that?
I have, yes.
And are the contents true to the best of your knowledge and belief?
Yes, they are.
Thank you. The second statement is dated the 6th of July 2018. So, in fact, this was adduced into evidence last week because it addresses Mr. Parsons' attendance on Charlie Rowley. The inquiry reference is INQ 004992. Nevertheless, I'll just ask you to confirm that in the same way. Have you had a chance to read through it?
I have, yes.
And are the contents true to the best of your knowledge and
They
belief?
are, yes.
So, with your permission, both statements will be adduced in evidence and
Yes.
appear on the inquiry's website. Thank you. So, if I could start, please, with your professional qualifications and role. Were you in March 2018 a paramedic with the South West Ambulance Service?
I was, yes.
In fact, a lead paramedic.
Yes, a lead paramedic.
Can you just tell us what that means?
A lead paramedic is a very junior rung on the management scale, assisting the running of the station and assisting any of the operations officers should the need arise.
Thank you. And at that time, did you usually work on the rapid response vehicle?
I did, yes, on the RF-18.
As I said, what we've heard of referred to as the RRV,
Sorry,
which
yeah,
you just
rapid
mentioned,
response
yes. Are you still a paramedic working for
I am still a
South
paramedic
West
working
Ambulance
for the
Service?
ambulance service, yes.
And had you in March 2018 worked as a paramedic for 10 years with the South West Ambulance Service?
I've been a paramedic for 3 years, but I've been in the ambulance service for 10 years.
Ah, thank you. If we could move to Sunday the 4th of March, and do refer to your statement if you need to, and I'll point to the relevant parts as necessary. What shift were you working?
I was on a day shift that day working out of Salisbury Ambulance Station.
Was that a 12-hour shift?
Yes, it was.
6 till 6?
I believe so, yes.
And were you working alone that day?
I was.
And what was your call sign?
608.
And did you receive a call to the Maltings just before 16:28?
So I didn't. It was an open broadcast over the radio channel because I believe other vehicles were utilised, and I responded to the open broadcast.
So you picked up an open broadcast?
Yes, sir, yes.
Got it.
Thank you, yes. So your statement says the incident call came out just before 16:28, so thank you for clarifying it's an open broadcast. Can you just describe the Maltings for us?
Maltings is a part of the shopping centre in Salisbury City. There's a grassed area with a river and a small play park near the Sainsbury's. There's a couple of shops on the left-hand side, depending on which way you look at it.
So in the town centre?
In the town centre, yes.
And retail shops nearby?
Yes.
And where were you when you received the open broadcast?
I was currently handing over a patient that I transported to Salisbury District Hospital.
So you think you were at the hospital?
I was at the hospital, yes.
And what information did you receive in that call out?
The broadcast came through as a female fitting or having a seizure in the maltings. And that came through as a category 1 call.
I think it said outside Superdrug in your statement,
Yes,
is that right?
that's right, yeah.
And so did you then attend that call?
I did, yes.
And we have some logs which indicate that your call sign, which you said was 608, arrived on scene 1631. Does that
That's
sound
correct,
about right
yeah.
to you? So we heard yesterday, did you hear yesterday the evidence of Helen
I
Wood?
did, yes. So from the point of call, I believe it was 11 minutes from when the call was received or the call taker took the call.
You were down at the hospital, weren't you?
I was still at the hospital, yes, sir.
Yeah.
So she felt it felt like a long time.
Yes.
But we've seen the call times, so you felt
It's-
you arrived in a matter of minutes.
About 4 minutes.
So could you tell us what happened when you arrived? And if you need to refer to your statement at page 1, please do.
Thank you.
Your first statement, so that's the 9th of
So I
March.
responded to the call with my lights and sirens to make progress to the incident because it was a high category job. I knew where it was in the maltings because I'd been to the area many times before, and I knew that I could get my rapid response vehicle up the pathway to as close as I could get it. When I arrived on scene, I was met by PC Collins, who gave me a brief handover of what he had and and it was still only a single female that was seizing on the floor, was the information that I got at the time. I approached and a lady was at the head end who
Could we
identified...
pause there just before we get there?
Sorry.
Just taking you back a bit. Where did you park?
I parked approximately 1 or 2 metres away. I know it's about a little distance away. It wasn't a far distance. It was enough to be able to open the boot and to be able to grab equipment should I need it.
And you say in your statement it was you knew the area, so you parked closest to Greggs and Superdrug.
Yes.
We heard PC Collins' evidence that he came over the bridge. Did you come in the same direction?
I came from the opposite side, so I came in from the Sainsbury side.
Thank you. And could you see the incident from your parked vehicle then?
I could, yes.
And what did you see when you arrived there in terms of police or other...
So I noticed PC Collins.
Was he on foot or...
At the time he was on foot. I saw a marked police vehicle at the other side of the incident, and I believe they put out some police tape, which we had to, a PCSO had to lift to allow me to come through. So I parked as close as I could.
So you saw PC Collins, you saw a marked police vehicle, a PCSO and a cordon. Anybody else?
I obviously saw the patient on the floor with someone at the head end, and there was a group of people just to the left-hand side of her at that time.
And did you take any equipment with you?
Not at that moment.
And why was that?
Just because I was literally going to get a handover from PC Collins to find out what we were dealing with, and because it was close enough, and then to get a handover from the person that seemed to be at the head end supporting the airway.
So you said, I think it was a single female having
Yes.
a seizure on the floor. Was that what you were told, or what was that?
So that's what I was told on the initial call, and when I got there was a lady on her side, and the person on the head end who identified herself as a paediatrician then told me that she thought that she was seizing.
And what was she doing?
She was doing a jaw thrust, and she was doing a good jaw thrust, maintaining the patient's airway.
And you said you saw the evidence of Helen Ord. Was that who it was?
Yes. I didn't know her surname, but I knew her as I thought it was Helen.
So she was doing a jaw thrust,
Yes.
and she said the lady was fitting.
She thought a lady was fitting, yes.
And what conversation did you have at that stage with PC Collins?
At that stage, I'd had a quick chat with PC Collins, and he thought that it was potentially a drug overdose. The area of the maltings underneath Sainsbury's is well known in the local community as where homeless people reside, and potentially drugs, some illicit drugs could take place there.
And could you describe, we now know the patient was Julia Skripal on
Yes.
the floor, could you describe her presentation and what action you took? And I'm on page 2 of your statement if you need to refer to it.
Like I said, that she was on her side.
Was that the recovery position?
In the recovery position, yeah, sorry. Apologies. And I said the female doctor had identified herself as Helen. She was still doing a jaw thrust and she thought that the patient was seizing. I didn't actually think that she was seizing at that point. From the fact that she had pinpointed pupils, she was quite slow heart rate, and it appeared to have some foaming at the mouth. We were assuming, because of those kind of presentation, that we were going down an opiate overdose of some sort.
If I could just break this down a little bit with you. So you said you say in your statement that her eyes were both looking to the left.
Yes.
You're saying now pinpoint.
Pinpointed and up over to the left, yeah, sorry.
And did you think she was unresponsive at that point when you first saw her?
Yes, she had a reduced conscious level.
So reduced but not unconscious? Or?
GCS of 3, which is the lowest at that point, so unconscious.
So
How
that was,
Unresponsive.
Did you say totally unconscious?
Yes,
Yes.
and this is from when you first saw her?
yes, believe so.
And you said foaming at the mouth?
Yes,
And in your statement you said that was quite excessive and she continued to do so throughout the incident. Is
Yes.
that correct? And what was the foam like? You describe it in your statement.
clear in colour with no odour and the same consistency to saliva.
And did she have a blanket on her?
Yes, I think she had a blanket, a green medical blanket that somebody had got from somewhere.
And what did you do with the blanket?
I took it off her and knelt on it.
And were you wearing PPE, personal protective
I
equipment?
initially had gloves on, yes,
You say
but
initially.
but I then removed them
At what stage did you remove them?
when they were getting in the way.
Could you tell us when that was?
It was wet, it was raining, it was quite a stressful situation going on. So my hands were quite sweaty and they were just providing no.
So
no
was this
protection.
from the early stages
Yes.
of dealing with the patient?
Yes.
And do you remember what Helen Ord, we know now, the female doctor, shouted to you when you first saw her?
She was requesting oxygen, to which I went back to the vehicle and got an oxygen monitor, and it was reading 98%, which is a good oxygen reading for that particular patient.
Thank you. If I could just slow you down a little bit. So she was shouting for oxygen. Do you
Yes.
remember her asking for suction?
I don't remember her asking for suction.
And you say you went to the car to get
Yes.
oxygen. Did you respond verbally to her to tell
No,
her?
I didn't get oxygen, I got an oxygen monitor.
Sorry, an oxygen monitor, my mistake. Did you respond verbally as well, or did you just go and get it?
Expressed what my feelings were. I expressed that she had good oxygen levels, and because she was doing a good jaw thrust with, I think I put the oropharyngeal airway in at that point as well, so the airway was being maintained.
So we heard Helen Ord describe the Goodell airway.
Yeah, oropharyngeal.
Is that the same thing?
Yes,
That was
it
what
is.
I was going to ask you. Thank you very much. And I think you agreed, did you, at that stage with her that Julia Skripal was unconscious?
Yes.
And was that clear from the way she tolerated the Goodell airway or the oral
Yes,
pharyngeal?
because a conscious person wouldn't tolerate an OP airway.
What can you tell us about anybody else who was at the scene at that point?
I think it was during my initial assessment that I noticed a gentleman sat to the side, but like I say, there were a few bystanders stood around us. It was then that I was made aware that they were together and that he was potentially a second patient. I think they were all that I was aware of at the time.
So at page 2, and I'm on the second and third paragraph of your statement,
Yes.
You mentioned that you were aware there were members of the public around, is that correct?
Yes.
I don't know who they were. They were saying something about a drug overdose. And then you say, I believe PC Alex, that's Alex Collins, mentioned the drug fentanyl. Can you
Yes.
tell us about that, please?
Yeah, I think we were, because previously to the incident in Salisbury, we'd had communications sent through the ambulance service saying that there was a specifically a highly toxic batch of fentanyl doing the rounds throughout the UK. And I felt that this met an opiate overdose signs and symptoms.
Sorry, potentially, what word did you use?
I can't remember, sorry, sir.
Potentially highly toxic.
Toxic.
Highly toxic batch of fentanyl going around the UK.
Thank you very much indeed.
Do you remember when that was, approximately,
I can't-
before?
It would have been before that, maybe a week or two.
So you think quite recent to the incident?
Yes.
But you say in your statement that it was PC Alex who mentioned fentanyl. Was that in your mind independently because of
An
what you
opiate
know?
overdose was. It
Right.
wasn't until he mentioned fentanyl that I remembered back that we'd had because I think he had something similar, but I can't attest to
see.
that.
And then you mentioned, sorry, before we move on to that. So when the communication came to you about there potentially being a toxic batch of fentanyl being around, did that advise you as to what the signs or symptoms of fentanyl
Yes.
poisoning might be? And do you remember what those were?
Yes.
Could you tell us?
Pinpointed pupils, vomiting, potentially urination, and sometimes rigidity in muscles.
And then you've mentioned that your attention was drawn to the second patient that we now know was Sergei Skripal.
Yes.
Tell me what you saw when you first noticed him.
I just saw an elderly gentleman sat on the bench and he just appeared to be vacant. But at that point, my colleague turned up in the second rapid response vehicle and I directed her to he, and then I continued with my assessment with the female on the floor.
So just going back to his presentation,
Yes.
and I'm at page 2 and the third paragraph down,
Mm-hmm.
You've described, as you did in your statement, that he had a vacant look.
Yes.
You also say in your statement he had his palms facing up and appeared frozen. He didn't
Mhm.
say anything. Is that correct?
Yeah.
Did you think at that time that the male and female were connected in any way?
At that point, it was starting to be, but nobody knew that they were together, so it was an assumption.
And was anyone attending the male patient at that time?
Like I said, there was a few passers-by, and I focused on the fact that my other colleague turned up, and I directed her over to him.
We've heard about the 1, 2, 3 training for potential chemical incidents. First of all, can you tell us what you understand that to be?
Steps 1, 2, 3 plus is something that we use, especially on a rapid response vehicle. If you go to any incident, if there's one patient on the floor, then it's safe to approach. If there are 2 people on the floor unconscious, then you approach with caution. And with 3 patients on the floor, you don't approach. This is all written down in our IOR, which is an initial operational response. It's all written down in the plan which is available to us.
So did that occur to you at that time?
Not at that point, because it was still 2 patients, so it would still have been with an approach with caution.
So did the 1, 2, 3 occur to you in the fact that, okay, we've got 2 patients here, so I approach with caution?
No, because like I said, it was only 1 patient initially.
So when you saw the
It-
second one, that didn't occur
It
to you
became
at that stage?
it was something in the back of my mind, but it would still have been an approach with caution. And I'd already been there with the first patient.
Thank you. And then you mentioned the arrival of your colleague. Who was that?
Lisa Wood.
We're going to hear from Lisa Wood later on today. And so do you remember what you said to her about the patients?
Not verbatim, but it was something along the lines of that I was dealing with an unconscious, unresponsive patient. I'd been made aware of a patient sat on the bench. Could she attend to him?
And then what did you do then?
Because we were thinking it was an opiate overdose, I suggested to Lisa that maybe she tried naloxone, and if it worked for her patient, that I would then try it on mine, because I was still trying to sort out an initial assessment on the patient that I was tending.
So you sent Lisa Wood to go and deal with the male patient
Yes.
and suggesting a potential course of treatment. And then did you go to your vehicle at that point to collect an eye gel and suction unit?
It was placed on my bonnet of my car, which isn't in the statement. But yes, I did. I got an eye gel to upgrade the airway, because it's a natural progression in airway, a stepwise approach to airway management.
And was the female doctor we know to be Helen Ord now, did she remain with the female patient looking after the airway?
She, after the eye gel was inserted, I believe, I can't remember exactly, but thought she was happy to look after the airway whilst we were doing other bits and pieces.
And presumably, were you happy because she had told you she was a doctor and
Yes.
had the correct skills?
Yes.
So can you just describe the treatment you gave to Julia Skripal once you'd collected the eye gel and the suction unit?
Yes. So I didn't consider Julia Skripal to be seizing. So there was no need to administer diazepam, which we carry as a full complement of drugs in in any vehicle.
So you did have it, did you, diazepam?
Absolutely, yes.
And was it on the vehicle or on your...
It was in a drugs bag in the vehicle.
But you didn't consider her to be fitting, so you didn't
No, I did not.
think that was appropriate treatment? Yes.
Yes.
Please.
I also didn't consider the need to intubate, which I am trained to do. We were happy with the airway because we had good oxygen levels. We had her on her back, and it was at some point that we noted that her respiration rate was dropping off, so we assisted with ventilations. By this time, one of the double crewed ambulances had arrived, and I'd asked them to get me a bag valve and mask.
Thank you.
Sorry.
No, that's fine. We're rushing on. Could I just
Apologies.
take you back a little bit? So when you went to get the eye gel and the suction unit, which you'd said was on the bonnet, did you then replace the Goodell, the oral pharyngeal unit, with the eye gel?
Yes, sorry.
Because is that the second stage of the
Yes.
stepwise approach to airway management? And was Julia Skripal still unresponsive at that point?
Yes,
And did you cut through her clothing?
I did, yes. I was looking for IV access.
Right, and did you...
Intravenous access, sorry.
Thank you. Did you see any marks on her body at all?
Not that I can call now.
Were you looking for any to do with drug overdose?
As we were looking for veins on her arms, it would have been something to have a quick look at.
And I think you said that you also placed defib pads on her body just in case they were required.
Yes, because her respiration rate was dropping off, and it's standard protocol just in case they do go into an arrest.
And you say in your statement that at that time, I believed at that time the patients were suffering from a neurological event of a drug overdose.
Yes.
So just to clarify, was it what had been said to you, the discussions about potential fentanyl? Was it the presentation, both, or other factors?
It was a little bit of both. As paramedics, we don't automatically arrive thinking it's one thing. We assess the patient, we assess the information that we gathered, and what observations that we can recall, and then we try and come up with some kind of thoughts in our head to try and see what route we're going down.
And you've explained in your evidence that you suggested to Lisa Wood to try naloxone. What was the reason for trying that on the male patient first?
Because I was trying to sort out the airway, because we were just making sure that the airway was secure, and she appeared the most unwell at that time.
And I should say we've heard evidence that that's a drug to try and reverse the symptoms of opiate overdose.
Yes,
is that
it
correct?
is. Yes, sorry.
What response was there, if any, to the male patient Sturgess Skripal to naloxone?
None.
So did that affect your assessment?
I think I still stayed where I was at that time.
So in your statement, you said nothing, and I'm sorry, at page 2, paragraph 4, nothing happened to the male Lisa was treating, so I ruled out opiates. Do you think that's right?
Yeah, I don't remember, sorry.
So is it you don't remember now whether you thought because naloxone hadn't worked? that it wasn't opiates, or it was unlikely, or weren't
It was
sure?
probably more than likely unlikely, but we still went down that route, if that makes sense.
Did you have other possibilities in mind?
Not to hand at the time. Possibly a neurological event or the opiate.
Thank you. And then you said, and I took you back a bit, but just to go to where you'd got to, I think, was the attendance of other colleagues after the administration of naloxone to Sturgess.
Yes.
Is that correct? So which colleagues?
That would have been Claire Gurnett, who's a paramedic, and Brendan McNamara, who was a student paramedic.
Thank you. And so what did you say to them?
I saw them approaching and asked them if they could get me a bag valve and mask. Because we were going to assist with ventilations, because a respiration rate was dropping, and I believe it dropped to about 8.
So did you give them a verbal handover?
Yes, I explained what I thought had happened, what we were dealing with, and what I'd done, or what we had done, including the doctor as well.
And was that in relation to both patients?
No.
Just Julia Skripal?
Yes.
And what was the condition of Julia Skripal when you gave that handover to your
She
colleagues?
was still GCS of 3, so unresponsive, and she was lying on her back. And at that point, the eye gel had been placed in, and they brought the bag valve and mask, and we then started to assist to ventilate.
So I'm now looking at the end of page 2, going on to page 3 of your witness statement, where you say the female was not breathing very well for herself. She had a slow heart rate.
Mm-hmm.
The female appeared a dirty airway due to her foaming. Could you just explain that to us?
Yeah, so a dirty airway is what we refer to if there is food or detritus or vomit or secretions that are in their airway affecting the operation of the airway, of the eye gel.
Do you know what it was in this case?
Excessive saliva?
So was that the foaming as well?
Yes.
And did you request the air support ambulance at that point?
Yes, I did.
And why did you do that?
Because they carry critical care paramedics, and they have enhanced knowledge, enhanced training, and carry more drugs than we do.
And if you need to refer to your statement on the top of page 3, but what was her breathing rate at that point?
It had gone down to about an 8
8.
breaths a minute.
So is that very poor breathing?
Yes.
And at that stage, did someone else arrive on scene? I think I'm halfway down page 3 now.
Yes, we had an officer who turned up, and he was just there to assist on scene if we needed any extra resources or any help.
Who was that?
Des Young.
And was he an ambulance person?
He's an officer, yes.
So when you say officer, because we
Oh,
have
it's in the
police
ambulance
officers
service.
as well.
No, sorry, apologies. He's an ambulance officer, yes.
I think you say in your statement he's the events manager.
Yeah, so he's a non-clinical, but he's a commander. He's an on-scene commander.
So does he assist with dealing with a scene rather than
Yes.
the clinical treatment?
Yes.
Thank you. So did there come a point at which you needed to move Julia Skripal to the ambulance?
Yes, because I'd removed her clothing, and out of dignity and respect, there's only so much that a blanket can do. So we came up with a plan to remove her to the back of one of the DCA's double-crewed ambulances.
And how did you achieve that?
We got a scoop stretcher, and we put her on the scoop stretcher onto an ambulance stretcher, and then loaded her into the back of the ambulance.
When you say we, who was that?
Myself and Brendan, with the help of Claire.
So the student paramedic and
Student
paramedic.
paramedic and the paramedic, yes.
And where was the female doctor at that point?
I believe she just didn't come into the back of the ambulance, and I think that she was no longer needed at that point.
Could you tell us who was in the ambulance when you loaded her onto the ambulance and what you did once you transferred her?
So it was the three of us. So the patient was on the stretcher. Claire Gurnett went to the head end, and she assisted the ventilations. I was at the middle of the patient, and Brendan McNamara was at the bottom of the patient.
And what was Claire doing?
Claire was managing the airway at that point.
thinking you say in your statement that Claire was suctioning quite a lot.
Yes,
And why was that?
because there was excessive bits and pieces in her airway.
And could you hear anything sound-wise?
Only the gurgling of when we were breathing forward. So when we assisted her ventilations, it was gurgling, which suggested that there was something blocking her airway, or something in her airway, sorry.
And what was her GCS at that point?
Still a 3.
And did you try to put a cannula in her arm?
I did, and very sadly I failed, because she was shut down. So her body had shut down and the veins had retracted.
So what did you do then?
Brendan was a student paramedic and had been past competent at doing an intraosseous access, which is the drilling into a patient's bone to make a space in the cavity to apply drugs via that route. And Brendan did that successfully.
And am I right in thinking that if someone were conscious, you do that with drugs to sedate them because it's painful?
So if you were going to do that to a conscious patient, you would give them lidocaine to make it less painful, because it's quite a painful procedure.
But here, she was unconscious, is that right?
Unconscious, unresponsive, and didn't require any drugs.
And did she respond at all to that process?
Not at all.
And what did that tell you?
She was unconscious and unresponsive.
And what happened next while you were still in the ambulance? And I'm on page 3, paragraph 3.
There was a knock at the door, and Des poked his head in, and a male was presented to us. He said that he was advanced life support trained, and to which we asked what kind of doctor he was, and he was a psychologist. And I felt that the 3 of us were able to deal with it, and he promptly left.
So someone else offering assistance, but in
Yes.
that case it wasn't needed. And what, if any, communications were there with Salisbury District Hospital before you attended?
Before
Before you attended the hospital, what communications were there? And I'm at paragraph 3, page 3.
so that was my colleague Claire. She did a pre-alert, so she would have given a pre-alert to the hospital to tell them what we had, what we suspected, and what treatment we were given, which is standard for all emergency jobs that are life-threatening.
Did you hear her do that, or did she tell you?
No, I don't recall, sorry.
So at that point, you'd asked for air support,
Yes.
but you're in the ambulance.
Yes.
Was there a choice then as to whether to wait for the air support?
We decided to see, so we were doing another top-to-toe assessment to make sure we hadn't missed anything, and at that point we could hear the helicopter above us, knowing that it would only take a second or 2 for them to land, so we decided to wait.
And just to clarify, the air support, HEMS or the helicopter unit, and critical care, is that all the same thing, just different terms?
Yes, apologies.
And so what further treatment did you give while you're waiting?
Whilst Claire was at the head end assessing the airway, the patient then went into something called trismus, which was clenching down. And I think it was at the point where Louise Cox, who's a critical care paramedic, arrived in the ambulance. She'd had a small, she had a quick handover. We agreed what we thought the working diagnosis was of a fentanyl overdose, and it was then decided that we would give diazepam in an emulsion to assist with the loosening of the jaw.
So before we get there, did you give naloxone?
Yes, we did it via the intraosseous in the knee.
So although you said earlier in your statement that Sergei Skripal had given naloxone and he hadn't responded, and you indicated in the statement that you'd ruled out opiates, but
Yes.
you've explained in your evidence today that it still was opiates was potential fentanyl. So you then tried it on Yulia, is that right?
Again, when Louise had arrived, they were, between the conversation that we'd had between her and Richie Miller, the other critical care, who'd attended someone similar a couple of weeks ago with a fentanyl overdose, we would try naloxone because it wouldn't have caused any harm if it hadn't worked.
So it wasn't absolutely clear in the statement whether air support had arrived before or after the naloxone, but you think they arrived and you discussed it and then it was administered?
Yes.
And you mentioned Louise, that Louise Cox,
Yes.
the critical care. Was she with someone else?
Yeah, Richard Miller.
And what were they saying to you when you were having this discussion about possible fentanyl?
So initially, Louise came in on her own, And then Richard popped his head in afterwards and said that it sounded similar to an event that he'd been to a couple of weeks previously with similar signs and symptoms, and confirmed or agreed that we thought it was still going down an opiate overdose in the form of fentanyl.
Had you had any experience of fentanyl yourself professionally?
Not myself professionally, only apart from what I told you that I'd read previously. But I also know that it came through. You can get it in a transdermal patch, which can be quite. You can pass it on if it come into contact with it via touch, because it's absorbed through the skin, and it can be quite absorbent.
So this is what I wanted to ask you about fentanyl. We heard from Helen Ord that she'd had professional experience of it in anaesthetics,
Yes.
and that she didn't understand it to be something that would contaminate. Are you saying that there's a different form of fentanyl that is seen on the streets?
Yes. In a hospital setting, then fentanyl will come in a vial and will be drawn up and administered intravenously. Whereas if it was to be used in an overdose situation or a recreational system, it would become in like a transdermal patch that you put on your skin, or you may cut a small square off and put it underneath your tongue sublingually.
So transdermal meaning it can cross the skin.
It's absorbed through the skin.
Right. So does that mean then that it can contaminate clothes
Yes,
or other
potentially.
people who touch it?
Potentially.
If it's the transdermal type rather than the hospital vial given intravenously.
Potentially.
And was that your understanding at the time?
Yes.
And do you recall whether that information about how fentanyl was apparent on the streets was given to you in the briefing about the problematic batch of fentanyl, or whether it was something you knew or learned elsewhere?
I would assume that it was the patch and not the files, because that's not sort of things that we would get dispatched to. I wouldn't have been aware of that.
Sorry, so just to clarify, did you, when you first found out about the patch or knew
Yes.
about that, its existence, was that from the briefing that you'd got through the ambulance service, or was it from other knowledge?
Just through the ambulance service, I believe.
Just through
The ambulance service.
people talking to each other.
Yes.
Yeah.
Sorry, sir.
Thank you very much. And we have the ambulance logs. Do you recall the ambulance leaving for the hospital with Yulia before or after Sergei Skripal?
I believe we left first. I don't remember. Sorry.
Yes, no, please don't say. Just say if you don't remember
I
anything.
don't recall.
I think we have it that the timings were that the ambulance with Sergei Skripal left at 17:06 and Yulia at 17:15.
Okay.
Does the timing sound about right to you?
I can't recall. Sorry.
And who was in the ambulance when it departed for hospital with Yulia?
So Claire Gurnett had removed from the head end, and I'd taken over the airway. Louise Cox was in the middle, and Brendan was still at the bottom. And Claire, like I said, was driving.
And how did you treat or manage Yulia in the ambulance?
We assisted her breathing en route, and that's all we needed to do.
Did you continue to monitor her?
She was continually monitored throughout, yeah, sorry.
So, and when you say monitoring, is that temperature, blood sugar, blood pressure, basic observations?
Yes.
And you'd mentioned her locking her jaw and that you administered diazepams.
Yes, which is a diazepam emulsion.
So that was after the naloxone.
Yes.
And what about the eye gel? Was that still in place?
Yes. It was seated correctly, and we were still getting good oxygen levels.
And you say in your statement you noticed the female had urinated at that point.
Yes.
Did you notice her having defecated at any point during the incident?
Not that I recall, no.
Do you think that's something you would have noticed?
Yes.
So as far as you were aware, she didn't. We've heard mention, obviously, from Helen Ord of that, but we also heard mention of mud at the scene. Were you told Julia's name at that point?
As we were leaving, I believe there was a knock at the door. One of the police, I can't remember who it was, gave us the name that they thought it might have been.
which I think you recorded in your statement as Julia Stripol.
I think that's a typo.
Yeah. So you think you were given the name Julia Stripol at the scene. Do you know how the police had the name to give you?
No.
Were you told the male patient's name?
No.
And were you told anything else about the patients at that time?
No.
So we have the logs indicating that you arrived at Salisbury District Hospital about 5:20 p.m. Who was there to meet you when you got to the hospital? Was there a team?
I believe there was a team in the resuscitation area, yes.
Was there anybody you knew, or did you know what level of doctor or anything like that?
Laszlo, who's one of the ED consultants at the Salisbury District, or was.
So that's someone you knew who was a consultant in the
I'd
hospital?
handed over to quite a few times previously.
And who gave the...
ED, did you say? Is that emergency?
Emergency department, sorry, sir.
Yeah, that's all right.
And who gave the handover to the hospital?
I believe it would have been Louise, because she was the senior on the... But I can't remember. It would have been a team effort, I expect.
I think you do say in your statement that it was Louise.
Yeah.
So what actions did you take at the hospital?
During the handover, we assisted by pat sliding the patient onto one of the hospital trolleys in the recess. And then we would have started cleaning our equipment after we'd handed over.
Just going back a moment, when Louise gave the handover to, I think you said Dr. Laszlo, were you there? Did you hear what was said?
No, I don't remember what was exactly said.
Were you there, or were you there when she was giving the handover, or were you dealing with the patient?
We would have been in the room at the same time.
But were you dealing with the patient at the same time?
By moving them from our stretcher onto the hospital trolley.
Yeah. And how was Julia Skripal when you left her?
Still the same. GCS, a lower level of consciousness, level 3.
So no real change
And
in her
being
condition?
assisted with the ventilation, yes. No change.
And how did you leave the hospital?
I don't remember. I knew I had to go back and get my car.
So at the top of page 4, we are in your statement, I think it says, I was then later taken back to my car.
I can't remember if that was
Can't
in the
remember how.
ambulance, or I can't remember if somebody else gave me a lift.
Thank you. And so you then went on to say that you had to clean your equipment. So did you go back to the ambulance station
Ambulance
for that?
station, yes.
And is that something you do after every
After every job, yes.
call? So clean your equipment and restock supplies?
Yes.
What time did you finish your shift?
I think it was about 8:30 according to the statement.
You say about 8 p.m. in your statement. And what happened to your uniform?
Nothing at that point. I went home and changed my uniform and put it in the washing machine, and it wasn't until the following morning that we'd had information came back to us and told us that we had to put it in double bags and take it back to the station.
So that was, you think, the next morning, so the
Maybe
5th,
in the afternoon or sometime during the second day.
the second day.
Yes.
You say in your statement that you put your uniform in the garage then.
Yes. There was an area allocated for uniform that was involved in the Salisbury. At that time, we were still going down the fentanyl, so...
Oh, so do you mean an ambulance garage?
Ambulance station,
Not
yeah,
your
sorry.
own garage.
Sorry.
And you say in your statement, I believe they may have been picked up by Public Health England on Wednesday night, Wednesday being the 7th.
Believe so.
So the sequence is you washed your uniform, the next day you take it into the garage, is that correct, to be
Yes.
bagged, and then it's collected on about the 7th, as
Yes.
far as you remembered at the time of your statement. And you explained to us that you took off your gloves fairly early in the incident because
Yes.
it was hindering you. Did you put them back on at any stage, or
No.
were you not wearing gloves for the whole
Didn't
incident?
wear gloves at all.
And can you remember whether you experienced any symptoms of being unwell after treating Julia
I
Skripal?
haven't, no.
After March 2018, what, if any, training did you receive about dealing with suspected nerve agent poisoning?
I remember emails coming through from senior management and from Mr. Darch that we've already heard from, and the emails coming down from Public Health England of what to look out for if it should ever happen again.
I'll just briefly go to a document we saw when we looked at the evidence in Salisbury, and it's INQ 000623. At the bottom of that page, clinical situation. Is this a document you were familiar with, firstly, before March 18? Yes?
Yes.
And we see there the symptoms and signs set out, clinical features for a diagnosis of nerve agent poisoning. Were you aware of those?
From the document, yes.
So you were aware of the document before March. Obviously,
Yes.
we know that March was the first time that a nerve agent had been used. Between March and June, were you reminded of this document?
Yes.
Was that part of the emails you refer to?
Yes. And it was printed off and put in the crew room table on Salisbury Station.
Put in where, sorry?
On the crew room table is a massive round table, and it was printed out, and we had access to read it via hard copy or via the intranet.
Is that table used to distribute information to people?
Yes. So yes, it is. Yeah. So we routinely have our lunch or our breaks there,
Yep.
and there will be any up-to-date or relevant information that you can read at your own leisure.
Right. Thank you.
Were you given any guidance about the potential overlap of symptoms between drug, opiate or fentanyl overdose on the one hand and nerve agent poisoning on the other?
Sorry, can you say that again?
Yes. Were you given any guidance about the potential overlap in symptoms or presentation between opiates or fentanyl on the one hand?
Yeah, it would have come through that document that we'd have seen. And then obviously the opiate overdose, we would know or have a
So you were
knowledge
given
of.
this guidance about each symptoms of each. Was there any training or guidance or explanation saying to you these are very similar presentations, so be aware?
I don't recall reading it, but I know, having heard Mr. Darch, that there was documented, but it wasn't disseminated. I don't believe it was disseminated down to our level.
So is your evidence that you were aware of the signs and symptoms of each, both opiate overdose and
Yes.
nerve agent, but you don't recall seeing specific documents highlighting the overlap? Given your personal involvement in the treatment of Julia Skripal, were you asked to take part in any training, discussions, seminars or any other types of learning exercises after the incident?
Yes, so we've had various meetings. Salisbury Ambulance Station moved up to the hospital, and we had various meetings in hospital room that was given to us by various subject matter experts.
Do you remember who organised those?
It will have been done through Wayne Darch or from the senior management team.
And do you think they were then, although it was at the hospital, it was something done by the ambulance service rather than the hospital?
Yes, because it was. We were literally. They gave us a room so we could operate as have an ambulance service out there.
So the hospital allocated a room to you. Was this for a specific period of time?
Yes.
So that you could do what?
Have an office that we could operate from
And when was this?
after the incident in March.
And so was that an office that you had on one occasion to do a training session, or was it more than one occasion?
But we had it for a couple of months.
So you had an office at the hospital for a couple of months?
Yes.
And so what sort of thing happened in those couple of months, and how frequently?
Sorry, what? Sorry.
What did you use the office for, and how frequently?
It's where our management team, because we lost the ambulance station, it's where the management team we would go and collect our vehicles from.
Okay.
Sorry, you said you'd lost the ambulance
The ambulance station got closed, so
because of the incident,
Yes.
or for some other reason?
yes, sorry,
Because of the
yeah.
So what I was asking you about was about any sort of training sessions or learning sessions.
Only
of-
these debriefs where we would discuss what had happened and what we'd encountered at that incident. And obviously stuff that was disseminated through emails.
So the debriefs, was
Yes.
that with the ambulance management?
Yes.
Were there any other bodies involved, like the hospital or the police or anybody like that?
I don't believe the police were involved. I don't believe the hospital involved, although I think we became aware that they had offered a blood test if we wanted them. But I think it was all due down to the ambulance service.
So this was internal debriefing after the incident. Yes. Did that involve you talking about your experiences to other ambulance personnel who hadn't been there?
No, so it was just people that had been involved with the incident.
Doing what?
Sorry, sir?
Doing what?
So anyone that was involved within the incident at all, we were invited to talk what we'd done, what we'd carried out, what we felt, any signs and symptoms that we'd had, or any information that we could pass on to the senior management so they could disseminate it back.
Thank you.
So senior management gaining information from you about your experiences,
Yes.
and you understood the purpose of that was to help them disseminate information to others.
Yes.
Thank you. After this incident and you became aware of the Skripal poisonings, did you yourself ever consider whether there might be Novichok discarded from the attack remaining anywhere in Salisbury?
No. Sorry, no.
And why was that? Did it just not occur to you? Or?
It didn't occur to me.
I'd like then to go on, please, to ask you a few questions about your attendance on Charlie Rowley on the 30th of June 2018, and you deal with this in your second witness statement of the 9th of July, which is 3 pages. So on the 30th of June 2018, were you on duty at 6:30 in the evening?
Yes, I was.
And was your call sign that night 993?
Yes, it was.
And was your first call of the evening to attend 9 Muggleton Road?
Yes, it was.
Where I think there was already a double crewed ambulance on scene.
That's correct.
And we heard evidence in Salisbury from Ben Channon, who was the ambulance paramedic who was on scene with his crewmate Lee Martin. Did you listen to that evidence?
Yes, I did. Yes.
And what were you called to do on that occasion?
I was acting, as I was a lead paramedic, I was acting as the on-scene commander until the on-scene commander himself had come down because he had some distance to travel. He was coming down from Bath, I believe.
And who was that?
That was Richard Tilsley, operations officer.
And were you asked to set up and manage the scene until he got there?
I was asked to go up and sort the scene out, yes.
And what communications did you have with the paramedics on scene before you attended?
So en route, I was in radio conversation with them, and I think I gave them the phone call as well to ask them what they'd been sent to.
So they being Ben Channon and Lee Martin?
That's it, correct, yes.
Do you remember, did you speak to both of them or one of them?
I don't remember which one I spoke to, but I spoke to one of them on scene.
And what did they tell you?
They described as what they were dealing with and what they were thinking. And
Could you tell us what that was?
They were thinking that because we discussed a possible nerve agent poisoning again.
So they told you they thought they were dealing with a nerve agent poisoning?
Yes.
And did they tell you the symptoms
Yes.
being displayed? Yes.
Yes.
And do you remember what those were?
The excessive salivation, the tonic evidence of his arms in a rigid state. Ben refers to it as a mooing kind of sound, an incomprehensible sound. And that's what I remember at the time.
So Ben Channon, we know, didn't attend the Skripal incident.
No, he didn't.
You
No,
did. So
I
did
did.
he ask you?
He asked me to confirm what the signs and symptoms that we had treated, and we discussed it together. Whilst en route, I was also made aware by our dispatcher that this was a second incident at the same address.
So they told you about a female being taken to hospital earlier that day from
Yes.
the same address. And what if how if at all did that affect your assessment?
It would have been the approach of caution with the steps 1, 2, 3 plus, because it was a second incident from the same property. It was difficult to get any signs and symptoms from the first incident because we weren't in attendance, but we were told that she had been in an arrest situation.
And had the ambulance crew, Ben Chan and Lee Martin, told you that they'd put on PPE?
Yes, they had, yes.
And we heard that was oversuits, overshoes and gloves before they
Yes.
treated them out. So nerve agent was specifically mentioned in that conversation, was it, when you were en route to the scene?
I believe so.
As well as the previous Salisbury incident?
Yes.
Did you receive any other information from anybody else about a possible cause of this incident?
I'd had a phone call from Fred Thompson, and he had suggested that this, again, was a second incident in the same property. And when I arrived on scene, I was met with the fire incident commander, Chris Browning, and he said, in words to the effect of, we've got another one. And that's where we discussed what we thought it was.
Okay, I'm going to come to the arrival. So just
Sorry.
going back to when you were en route, did you speak to anyone else when you were en route? Was the Fred Thompson conversation en route or later? You don't say in your statement, so if you don't remember.
I don't remember, sorry.
So then, did you arrive on scene about 7 o'clock?
Yes.
And you've indicated, I think, that the fire brigade were on scene at the
Yes,
time.
they were, yes.
You mentioned the Commander Chris Browning. And were the police also in attendance?
Not
when
at
you
that
arrived?
time.
So in your statement, you indicate, page 1, the fire brigade were also on scene. I spoke to their incident commander, Chris Browning, at the scene and decided to put a cordon in place about 50 metres from the house. I remained outside the cordon the entire time I was on scene. The police were also in attendance. So
Okay.
do you remember now whether they were there when you attended or whether that was
I
slightly
don't remember if they were there whilst we were there. Whilst on our initial arrival, sorry.
And it may be obvious, but why did you decide to put a cordon in place at about 50 metres?
For the protection of any responding agencies and for the public as well.
Is that in normal distance? Is it a distance recommended if there is potential nerve or chemical poisoning, or is that just a judgment call?
It was just a judgment call because it seemed far enough away.
At that point, did you consider it to be a major incident or likely to be a major incident?
No, I'd had a phone call with Operations Officer Rich Tilsley, and we discussed whether we would go to major incident standby, which is a step down from a full major incident declared, and this would enable the senior strategic officers within the services to initiate phone calls and then initiate working together.
So did you go to that major incident standby position?
Yes.
And it may be obvious again, but why did you stay outside the cordon the whole time?
There was no need for me to approach me because it was to remain, because I was there as an on-scene commander at that time, not to get involved medically with the treatment unless needed.
So was it for your safety, or was it because you weren't involved with the treatment, so you didn't need to be there, or both?
A bit of both, to be fair.
So you do say in your statement police were in attendance. Do you recall any communications with the police yourself?
Yes. So a police officer arrived. Myself and the fire incident commander were stood together.
Do you know which
outside.
police officer, what rank or
I
name?
believe it was Acting Sergeant McCurley, sorry.
Sorry, did you know that at the time, or is this from having heard him give evidence?
I know his name now from giving evidence, but I've known him visually throughout my career.
Thank you. So he attended.
He attended and crossed the cordon, saying that he had intelligence that it was a drugs overdose.
Did you
Well,
say
this was-
anything to him about crossing the cordon?
Sorry, you were going to...
Yes.
I'm sorry, I think you cut yourself off part way through, Mr. Parsons. He crossed the cordon saying he had intelligence,
That he thought that this was related to drugs.
and did you say something else?
No.
Thank you.
Sorry.
Sorry, I may have missed the next bit. Did you say anything to him about crossing the cordon?
Yes, I said that it sounded a lot like what happened in Salisbury, and we set up a cordon to protect people.
And what
And
was his response?
He just walked across.
So were you effectively telling him not to
Yes.
cross the cordon?
And the fire commander.
And the fire commander told him as well?
Yes.
But he ignored that?
Yes.
Did he say anything in response or not?
No.
Did you ask him anything about the intelligence?
No. He said that he'd had intelligence for drugs, and I explained to him that I thought what we thought we were going down, and he still carried on with his colleague.
So did his information that he had intelligence about drugs change your view in any way? That it
No.
was. No. And why was that? Was that because what you've heard from the ambulance?
From Ben and from Lee, yes.
You say in your statement you spoke to the NILO, National Interagency Liaison Officer.
That's correct, yes.
Could you explain who that is, please, and what was said to them?
And the NILO is someone that you can contact, and they operate at a level where they can coordinate with other agencies. They can speak to the police, they can speak to the fire, or the hospitals. And he'd asked me, what was the second part of the question, sorry?
Just what was said in the conversation.
I said what we thought it was and what we were going down. And at that point, he'd asked us to check to see if there's any obvious paraphernalia, drug paraphernalia lying around the property.
And so what did you do in relation to that request?
I relayed that to Ben and Lee.
And did you also tell them that you'd set up a cordon?
Yes, they were informed that a cordon had been set up, yes.
And I think you said you also spoke to Richard Tilsley, who was the operations officer.
Correct.
Was that when he was still en route?
Yes.
What actions did you agree with the fire commander, Chris Browning?
We were going to transport the patient via the ambulance. The fire service would get dressed in some protective clothing, but to do this they would need to set up some measures that they needed to have in place, and they were going to drive the ambulance with the patient in the back.
And in your witness statement you say that this plan included the input of NILO and Richard Tilsley.
Yes.
So does that mean that you were all in agreement as to what
Yes,
was
a
going to
part
happen?
of GESIP principles is that you kind of had a huddle, or you get together with each agency and you come up with a plan together and to work through it.
And so did that huddle, that plan, GESIP plan, involve the police at all?
We tried to, but I think unfortunately he was very adamant that he knew what it was and didn't believe us.
And did you have ongoing communications with Ben Channon and Lee Martin?
Yes, via radio.
Were they updating you with the treatment and the
Yes.
signs and symptoms? And how did these updates impact your assessment, if at all?
It didn't change it at all.
Did it make it any more or less certain?
More certain, the more that they were discussing, and that they'd ruled out any drug paraphernalia, so we were going down the route that we were going down.
Could we please just go to INQ 004992? This is your witness statement. Thank you, page 2. I'm looking for the section that said yes, 3 lines down. You say, I had been the first responder to the nerve agent poisoning of the Skripals in early March 2018.
Yes.
And everything this mail showed was cementing in my view that this was again nerve agent poisoning. Staying on that page, could you just explain the key factors that stood out to you that made you think this was another nerve agent poisoning?
Yes. So the signs and symptoms that it was the excessive salivation, the pinpointing of the pupils, the fact that the naloxone hadn't worked, and then it was the dissociative when he was making the weird abnormal noises. I think Ben refers to it as mooing, and the fact that his arms were doing weird things.
So you hadn't seen him yourself, had
No.
you, Charlie Rowley? So this was the information that you were
Yes.
gaining from your colleague about the presentation.
Absolutely.
But that was the detail of the description, was it?
Yes.
So you go on to say in your statement, I made all the people on scene aware of my thoughts and we all agreed to treat it as such.
Yes.
This meeting is referred to as a Joint Emergency Service Interoperability Principles, GESIP.
Yes.
During this GESIP, Richard Tilsley had arrived and assumed overall command. I was updating Richard with a handover and he asked me to write up a major incident report.
Yes.
So who do you mean when you say all the people on the scene there?
So the fire service, and we attempted to talk to the police officer who tried to recross the cordon and come out of the cordon, at which point we discussed the plan that we were coming up with to get the patient to hospital.
Was that still Sergeant
Yes.
McCurley?
Okay.
Because we did hear evidence in Salisbury that Wiltshire Police Inspector and Police Sergeant decided to treat it as a drugs overdose. Did you speak to the inspector at any stage?
No.
The inspector gave evidence at the inquiry in Salisbury and said in his evidence that he decided to treat it as drugs overdose and got hold of the scene commanders for fire and ambulance and said that the ambulance commander was accepting of the decision, but the fire commander not so much. Firstly, were you involved in the discussions or were you aware of them at all?
I was involved in the discussion, yes, but I disagreed with Mike, on-scene commander.
Were you aware of the conversations between the inspector, Beresford
Sorry, you
Smith?
disagreed with whom?
My on-scene commander, so the ambulance on-scene commander.
Mr. Tilsley.
Yes. Sorry, sir.
That's all right. I just wanted to be sure what you were saying, that's all.
Could you just explain that for us? So when you,
Does it explain?
with Mr. Tilsley,
Yes. So he was, because the inspector, and I believe they'd had a phone call with the hospital in between, and the hospital had suggested that they were treating Sturgess as a drug overdose at that point. So Mr. Tilsley was inclined to believe the police inspector and the police at that point. But I still disagreed, along with my colleague Ben and Lee.
So if I'm understanding this correctly, then once Mr. Tilsley had spoken to the police
Yeah.
and understood there to have been conversations with the hospital saying the earlier patient was being treated as drug overdose, he was accepting, was he, of the police position to treat this as a drugs overdose, but you and Ben Channon
And Lee Martin.
and Lee Martin disagreed
At
and
that
you
point,
thought
yes.
that it was nerve agent poisoning. And did you tell him that you disagreed?
Yes.
If we could go just to INQ 004993, please. This is the witness statement of Richard Tilsley, and on page 1, you'll see the highlighted section in front of you. Once at the fire cordon, I spoke with the fire incident commander. We requested police, and along with fire crew and Ian Parsons, we held a JESIP meeting to discuss a mutual plan of dealing. We had decided the incident was very similar to the nerve agent incident we dealt with in early March 2018 and would deal with this in the same way until told otherwise. Does that accord with your recollection of the initial JESIP you had, where you, before the point of you're saying that the police were saying it was drugs overdose,
Yes.
when you described talking to the fire service and Richard Tilsley,
Yes.
is that the JESIP meeting
Yes.
you described? And then we go on to page 2, please. He then says, I then spoke further with the fire commander and also a police inspector who was also inside the cordon. I'd not seen him earlier and he'd not been part of any conversations I had had. He confirmed to me that the female treated earlier that day had been drugs related, and although he didn't say it, appeared to me that he thought this male was the same. I then stood down our heart hazardous area response team and the fire stood down their equivalent. At that time, I decided that given the information about the female and also the input from officers on scene, I stood our teams down. The scene was then left in charge of police and I drove to Salisbury Hospital where I met up with our team. So does that accord with what you've told us, that Richard Tilsley, the reasons why he was standing it down?
Yes.
But that was a position you did not agree with?
Correct.
Could we go to INQ 000654, page 16, please? This is the ambulance log we've looked at previously. I'm afraid it's quite difficult to decipher, but I'd just like to go to an entry we looked at with Mr. Channon, and that's 1928-19. And if we can possibly highlight the section LP993. ADVD advised, I think, he and 7710 both attended previous SALS incident and state, along with fire, PTS patients are presenting with similar incident. You've said your call sign was 993, so do you understand that to be referring to you?
Yes.
Do you know who 7710 refers to?
I believe it's a Ben and Lee. I'm not 100% sure, sorry.
And you say in your witness statement, thank you for that, that on page 2, you became aware that Ben and Lee had come outside with the patient and were loading him onto their ambulance, 7710,
Yes.
so that would seem to accord. There were also 2 police officers with them who had entered the cordon despite being told not to. We've heard evidence that was Sergeant McCurley and PC Porter. And you've said that you told them not to, effectively,
Absolutely. Not to cross the cordon, yes.
and also the fire commander.
Yes.
Do you remember that being 2 officers, or was it just Sergeant McCurley when you...
It was 2 officers.
You also described the police officers in your statement jumping into the ambulance to drive to the hospital, which you said had not been the plan as we had decided to use a fire officer in PPE suit. I made it clear to Richard Tilsley that I didn't think it was a good idea, but the officers were given permission to drive away.
Correct.
And just to clarify, what was the reason you didn't think that was a good idea?
The 2 police officers weren't wearing any protective clothing. They had gone into the property, putting themselves at risk. They had told my colleagues, Ben and Lee, a complete fabrication of what the plan was and said it had changed. I was very surprised when I saw them at the back of the ambulance because I'd had a plan with the fire commander and had the police sergeant come back and tried to speak to us. We'd have informed him of the plan, but he went against it because we had firefighters getting in protective clothing to drive the ambulance
So
to the
were
hospital.
you worried about contamination risk?
Absolutely.
So I'm conscious of the time, but I only have a few more questions, so if I can...
Well, let's ask shorthand writers.
Yes, of
the person
course.
who's under pressure. Can you cope?
I will only be a few minutes.
Finish if you can, please, Ms. Farr.
Thank you very much. You then described the ambulance leaving and you following to the hospital, but overtaking so that you could help organise the receiving of the patient.
Yes.
Could we go to INQ 004992 and page 2, please? You'll see the highlighted section of your statement. I arrived about 5 minutes before the ambulance and spoke to Resus. They told me the patient was going to be treated as a drugs overdose and the incident had been scaled down. Did you give any handover to the hospital?
I don't recall, but reading my statement, yes.
Did you tell them that you thought it was nerve agent poisoning?
Yes.
Despite the fact that it had been stood down and
Yes.
was being treated as drugs, but you felt you did tell them that. Do you know who you told
I can't remember, sorry.
or what level of doctor or nurse?
Whoever the consultant was in waiting or whoever was waiting for us in the resus room.
Did you explain the presentation that you'd been described by your colleagues?
No, because I think I'd left that to Ben to do, Ben or Lee, because they were the clinicians dealing with the patient.
Do you remember anything else about what you said to the hospital?
Afraid not, sorry.
And then you described putting on gloves both to assist a hospital nurse with the treatment of Charlie Rowley and to clean the ambulance with Ben Shannon. Was that because you still believed it was nerve agent?
Yes.
Was there any conversation between you and Ben Shannon when you left the hospital and cleaned the ambulance together about the incident?
Just about what we'd seen and talked through the incident.
Were you still determined at that point that it was nerve agent?
Yeah, as was Ben.
And then I think you cleaned the ambulance, and was it then put back into service for the rest of your
I
shift?
don't recall, sorry.
Thank you very much. Those are my questions. So I don't know whether there are
Are
some...
you likely to have any questions in those circumstances?
They're follow-up questions to the one. I'm not repeating the same questions, but there are some follow-ups.
How long are you likely to be?
10 minutes.
I think do that now.
Yes, certainly. Good morning. My name is Michael Mansfield, and I represent the family of Dawn Sturgess Just a few matters. I'll keep it chronological so it's a bit easier for you to recall, because I appreciate the lapse of time. So, first of all, I want to just deal with this, I'm going to call it the Skripal scene in Salisbury that you attended at very close quarters. And particularly the question relates to fentanyl and your recollection of fentanyl. What did you understand in relation to the administration of naloxone? Because both patients had that administered at the scene. What did you feel that that effect would have on somebody suffering from a fentanyl overdose of some kind or another?
If it had been an opiate overdose with fentanyl, then the naloxone would counteract the drug that they'd had.
Right. So the position in Salisbury, as far as that is concerned, that's fentanyl, would it be fair to say that since there was no reaction and you would expect that very quickly, as we understand, is that right?
Yes, sir.
Yeah, therefore you effectively, as a working basis, ruled out some kind of overdose in the Salisbury incident. Is that fair?
Yeah, because we describe it as a potential neurological event through an overdose.
Right. Now I just want to move on to the...
Sorry, do you agree or not, Mr. I'm just not quite clear what you're saying. What you're being asked is, when the naloxone didn't produce an immediate effect, did that mean that, as far as you were concerned, it couldn't be fentanyl?
It was still on the card, sir.
It was
still a thought process, yeah.
Was it? And why was that?
Because we were trying to ascertain what we were dealing with at that time.
Still didn't know. I see. All right.
Now I want to move to the next stage, that is, in the period after Salisbury, clearly you were a prime observer and participant, so you had a lot to convey to other people, is that right?
Yes, sir.
And you did that?
Yes, sir.
Did you ever see anything disseminated on the back of what you told the management?
From Public Health England, we had some emails, and through emails disseminated from our senior management team.
Now, just 2 points arising out of this. And I put this specifically, that none of the disseminated material that came out of your participation in this exercise, none of that material actually indicated how you would distinguish between the symptoms and signs of a nerve agent, if you like, and the symptoms and signs related to an overdose, did they? I mean, can you remember, I'm sorry to put it this way, can you remember any document that pointed out the real risk of confusing the two, what the confusion related to, what signs and symptoms, and whether there were any...
Hang on, Mr. Mansfield, one thing at a time.
Yes, I'm putting it globally first.
I know, but please don't. I'll ask him specifically.
Yeah. Did any document...
Did anything tell you, look out, these things can be confused?
After the
Salisbury's?
Yes, I believe so.
I'm so sorry?
I believe so, yes, sir.
But can you remember that document? Because
I can't remember the document. We had lots of documents explaining
Yeah.
everything in and around the Salisbury incident from Public Health England and from our senior management team.
You see, we understand from Mr. Darch that there is no document that actually does that.
Okay.
So do you think you might be mistaken about that?
Possibly.
Possibly. All right. Well, then, the second question, I'm sorry to have put it globally, is that can you recall now whether there's a distinctive feature so that you on the ground in future would be able to say, that's it, that's why it's nerve rather than overdose? Sorry to put it in that form.
We've got our JR Calc app on our phones, which gives us some signs and symptoms and what to look out for, and we have documents that we can refer to.
Yes.
Whilst on scene.
The question's rather more specific. Was there advice then, was there advice about any distinctive feature?
I don't recall, sir, sorry.
In other words, was there an acid test?
Yes. Acid or litmus, one of those.
Whatever, yes. Was there a definitive test which would enable you or anybody else to tell this is one, it can't be the other?
I don't believe so, no, sir.
Right.
Thank you. Then, just moving on again, please. The dealing still with the same period. It's after Salisbury, but before Amesbury, all right? Was there any discussion in that period, as far as you're concerned, involving you, in what protective measures you would have to take, if in fact you suspected or strongly believed, one of the two, that it was a nerve agent and not an overdose?
We would still adhere to the steps 1, 2, 3 process.
Yes, well the problem with that, if I can put it to you, is if you've got less than 3 and it is a nerve agent, the problem's still there, isn't it?
Correct.
Right. What provisions were made, measures were suggested that you would have to take to protect the community?
I don't know, sorry, sir.
So you're very softly spoken. I think you're saying no, there weren't any?
I said I don't know, sorry.
You don't know. You don't know.
I don't fully understand the question.
Because do you accept that where there might be a nerve agent poisoning, I'm putting it shortly, there is the risk that the community surrounding the area, wherever it is, could be affected? You agree?
So,
Therefore, there is a need to have in place advice as to how to protect the community if you think it might be nerve poisoning.
that wouldn't be something that, as a paramedic on an RRV, we would sort out. We carry duodote on the ambulances and cars.
But was there advice about cordons, distances?
I don't recall, sorry.
You don't? And providing information to the public, that kind of thing?
No.
No.
Would it, yes, but just help me. Is it part of your job as a paramedic to alert the pub, to tell the public about this kind of thing?
No.
Right.
And whilst it may not be your job, of course, you would want some part in advising people whose job it is.
Correct.
And that's the police. Is that right?
Yes.
And on this occasion, just moving it forward, it was apparent that when the police arrived, they weren't, as it were, having due regard to your thoughts, were they?
Not at all, no.
Now, I just want to deal with this last stage where the police arrive and we're now dealing with Amesbury. It's clear from what you've said that the paramedic team were all of one view, is that right?
Correct.
And you made that view known to the police?
Yes.
Has there been discussion since Amesbury about how a situation like this, because it turned out you were right and they were wrong, how this would be resolved without causing risk to the community in future? Have there been discussions about this?
Not that I'm aware of.
Not that you're aware
Not
of?
that I'm aware of, no. It's all part of our JESIP principles that we all work towards and we all work together
Yes.
with.
Well, it plainly didn't work on that occasion, did it?
No, sir.
So all I'm asking is whether the public can be reassured that in future we're not going to get a situation like this. Can you help us about that?
I can't answer for that,
You
sir.
can't, all right. It's not a criticism of you, I just want for information to know if that's possible. Yes. I have no other questions.
Thank you very much indeed, Mr. Mansfield. Is there anything else, Ms. Whitelaw?
Not from this witness, thank you very much.
Right. Mr. Parsons, thank you very much indeed. That's all. There's no need to stay unless you want to. And in any event, we are going to break now until 11:45.
All rise.
Could everyone please take their seats now? We should be starting very shortly.
Yes, Ms. Whittle.
Thank you. The next witness is Lisa Wood.
Repeat after me. I do solemnly,
I do solemnly,
sincerely and truly
sincerely and truly
declare and affirm
that the evidence I shall give
shall be the truth,
the whole truth,
and
and
nothing but the truth.
nothing but the truth.
Thank you. Take a seat.
Thank you, Ms. Wood. Please sit down. The microphones are really there to record rather than amplify, though they do a bit. So speak up and speak clearly. The questions will come from over there.
Could you give us your full name, please?
Yes, Lisa Samantha Wood.
You should have in front of you a copy of your witness statement. It's 6 pages and dated the 13th of March 2018.
Yes, I do.
The transcript reference is, the reference for the transcript is INQ 004936. Have you had the chance to read through the statement?
I have, yes.
And can you confirm the contents are true to the best of your knowledge and belief?
Yes, yes.
Thank you very much. So with your permission, the whole statement will be adduced in evidence in the usual way.
It may.
Thank you. If I could start then with your professional qualifications and role, were you in March 2018 a paramedic with the South West Ambulance Service?
Yes, I was.
And at that time, in March, for how long had you been a paramedic?
I'd only been a paramedic for about 2.5 years.
What did you do prior to that? Was it involved with the ambulance service or
No.
something else?
No, it was something else.
And are you still a paramedic?
Yes.
Working with South West Ambulance Service?
I am, yeah.
We move then to the events of Sunday the 4th of March, and if you need to refer to your witness statement, please do so.
Yeah.
Where were you when you received the call to the Maltings?
So I believe I was on the ambulance station on standby, so I will have been up in the crew room when I received the call. So I was allocated the call.
So was that the ambulance station on Oddstock Road in
Yes.
Salisbury?
Yes.
Were you single crewed?
Yes, I was on the rapid response vehicle that day.
And what was your call sign?
I believe it was 671.
That's what you say in your statement.
Yeah.
And did you receive that call at about 16:27?
If I can just refer to my...
Yes, of course, page
Sorry.
2.
Yes, so 1627, I got that.
And what information were you given?
I believe at the time I was literally just given that there was a patient fitting in the middle of town.
So was that an urgent call?
Yes, fitting comes through as a Category 1 call. Yeah.
And when did you arrive on scene?
I believe I got onto scene again.
No, please do.
I've had children and all sorts since this incident, so memory's not as it was. So I got onto scene 1631.
And what kit did you take with you to the scene?
So I, being on the car, and unfortunately I couldn't get quite as close to the scene as I would have liked to. So I literally grabbed everything I could. So I grabbed my green bag, my drugs bag, oxygen. I think there was a couple of other bits I grabbed. I did make notes.
It's on page 2 and second paragraph.
Yes,
third
so
paragraph.
I grabbed the defib, and which is the monitoring, and my EPCR, which is the patient record that we record everything on.
So you said you couldn't get as close to the scene. Where did you park?
So I followed the sat nav on the car that brought me to the library. Normally I would have driven very carefully through that underpass, which would have got me to the bridge, and then I could have walked across. But unfortunately, the cordon had already been set up by the time I got there, so there was a police car in the way. So I just parked up next to him and then grabbed my kit and walked very quickly through the
You
archway.
say in your statement you pulled up behind a police van. Was it a police car or a police van, or do you not remember?
Sorry.
A police vehicle,
A police vehicle of some description was in my way.
but by the library.
Yes.
And what did you see as you arrived, or who did you see?
Vague recollection of obviously Ian was on the floor with the female patient. There was a lot of bystanders. Police were on scene.
So that was Ian Parsons, was it?
Yes, Ian Parsons. He then directed me to the gentleman that was sat on the bench, and that's when I obviously recognised that there was a second patient sat on the bench.
So in your statement, you say, and we're on page 2, I could see my colleague Ian getting kit out from his car, which was parked close to the area where Sergei and the female, whom I now know to be Yulia, were.
Yeah.
So when you first arrived, was he getting kit out of the car, or was
So-
he with the patient?
From where I can, so the walkway from where I came from my car, I could see Ian on the floor, and then obviously as I got to the scene, he was then getting kit out of the car.
Thank you. And what did he say to you, firstly, about the condition of each patient?
Again, referring to my witness statement, I don't recall him saying anything about the patient on the floor, but he said the chap on the bench needed assessing, and he would like me, that's where he directed me to.
So you say that in your statement, you say that he said to you that the male patient was on the bench, able to maintain his
Yes.
own airway, but
Yeah.
could you assess him?
Yes.
But you also say in your statement, which you may not remember now, Ian and I walked towards each other, and I recall that he shouted words to the effect the female patient, Yulia,
Yep.
was in a worse condition than the male
Yes,
patient.
yes, he did. Yes, because she was unconscious on the floor.
And do you recall what he said about Sergei Skripal, the male patient's presentation, and any treatment that might be needed?
We had a very rapid conversation, that the fact that Sergei was maintaining his own airway, he was still upright and conscious, and that there had been talk of naloxone needed because of a potential drug involvement.
You say in your statement that he mentioned him having pinpoint pupils. Do you remember that?
I'm sorry, I'm
Don't.
so sorry.
No, that's fine. And please do refer to your statement. As I
Yeah.
say, that was made, only days after the
Yeah.
incident. So
Ms. Laird, don't feel you've got to think of an answer if
Okay.
you really can't remember. On the
Yeah.
other hand, if the statement helps you remember,
Yes.
use it.
Okay, lovely. Yeah. So yeah, in my statement, I've obviously said that Ian had mentioned pinpoint pupils. So I then went and assessed, and Sergei also had pinpoint pupils.
but I think you did recall that he'd also mentioned naloxone
Yes.
to you.
Yes.
And did you request P1 backup?
Yes.
And what is that, please?
So P1 backup is the highest priority backup that we can request. Being on the RRVs, it's quite important to get that in quick if it's required, because obviously we are not conveying resources. and we are only single-manned. So in these sorts of situations, more personnel on the floor is required, and a conveying vehicle is required.
And looking at the top of page 3 of your witness statement, can you tell us specifically what you asked for in terms of backup?
So if I remember rightly, I think I literally just requested the 2 vehicles because we had 2 patients, which was potential 2 conveying, and we can only carry 1 on each vehicle. So with the 2 patients, we required 2 conveying vehicles, or the DCAs. And I believe I requested HEMS, although I don't remember doing that.
So you say that in your statement, but you don't remember it now, is that right?
Yeah.
And who was present as you approached Sergei Skripal? And we're on page 3 if you need to remind yourself.
So I believe there was a member of the public and a female officer with Sergei. I don't remember much about the police officer, but the female that was with him introduced herself as an ICU nurse. It gave me his name, I believe she did, and just said that this is how he'd been since she found him.
So we heard from, in fact, in intensive care, Dr. Helen Ord yesterday. Did you hear that evidence?
No, I didn't, I'm sorry.
And did you see Yulia Skripal, the female patient, at that point?
A very brief glance down as I walked. I had to walk past her, so I very briefly saw her on the floor, but nothing more than a brief look.
So was she being attended to?
Yes.
And your focus was on Sergei
My
Skripal?
focus was on Sergei as instructed.
And so can you describe for us his presentation when you approached him, please?
Yes, so I vividly remember him being sat very still, up, like bolt upright on this bench. He didn't acknowledge my presence at all. His arms were rigid, and I believe he'd also been sick at that point as well, so there was vomit. If I recall, his breathing was normal. So I had to then apply monitoring to get further information.
So before we come to your assessment, do you recall the ICU doctor, what she said, how she described Sergei Skripal to you?
I'm sorry, no.
That's fine. Can we just refer to your statement?
Yep.
I think you say that she said Sergei had been in a catatonic state.
Mm-hmm.
Do you recall that now? Reading that, does that remind you or not?
Yes, I believe she. I vaguely remember her saying that he'd been in this catatonic state.
Did I mishear? You referred to an ICU doctor. Do you mean Miss McCord?
Sorry, no, we're referring to Helen Ord.
I don't think it was Helen that was...
So you think it was the nurse?
Yeah,
because there was a nurse, Alison McCourt, at the scene.
It was Alison that was stood. Sorry, yeah, I should have picked that up. Yeah, no, it wasn't a doctor I spoke to. It was definitely a nurse that was stood with me.
Thank you.
And then you were moving on to talk about your assessment of
Yes.
Sergei Skripal. So
Yes.
please do continue.
So the initial assessment, I literally sort of felt for a pulse, which was nice and strong. And then I applied our SATS probe, which tells us how much oxygen he's got, and the pulse, which again, I believe all came back within normal ranges. I then moved on to do an ECG just to make sure that the pulse was reading true. And I believe that's all I got round to at that time.
Did you hear any sounds to do with his breathing? Can you remember now?
I don't remember him making any particularly horrible breathing sounds. He was breathing normally. It wasn't rapid. It wasn't slow. I don't remember hearing any what we refer to as like a gurgling sound, if there's or wheezing or anything like that, which would indicate an obstructed airway. And I don't recall him ever talking to me at any point.
Did you try to elicit a response from him?
Yes, sorry, I did. Yes, as part of our assessment to assess GCS, which is the level of consciousness, a painful stimuli is applied. Back then, it was applied to the sternum, and I believe I applied it to the earlobe as well.
Just describe for us so we understand how you do that.
So you apply a level of pressure to those particular areas which are quite sensitive, and that should elicit some sort of pain response. So if I was to do it to you, for example, you would be a bit like, "Oh, that's not comfortable," or you'd swing for me. An unconscious patient wouldn't. It's based on a level, so the worst case scenario, they don't respond at all, and then it gradually goes up to a flinch or a reflex, and then obviously a full response.
What was Sergei Skripal's response?
I don't believe he responded at all to that painful stimuli.
But is breathing normal at that stage, and was his pulse also normal at that stage?
Yes.
And what did you do next?
I believe I gave the naloxone as instructed, suggested.
Before you get to there, I think, did you apply the defibrillator?
I didn't put any defib pads on him. I had no reason to feel that was necessary at that time. As I said, his pulse was strong. He was holding his own airway, and he was sat upright.
So can I just take you to your statement halfway down page 3? You say, "I then grabbed my defibrillator and put it on the bench next to Sergei."
Yes. So,
And-
sorry.
please,
So that's
keep
how
going.
we monitor. So it says the defibrillator, but that's how we apply the ECG dots, and that's what we get an electrical heart reading from. And I applied the ECG dots, just a very quick 3-lead, which is actually 4 leads, but it's a 3-lead, to see if the pulse was true to what was on my the SATS monitor.
And I think you said you attached those to his shoulders and hips.
Yes, I believe so.
And what were the readings then in terms of whether they were normal or not?
I believe it came through as normal. I don't recall any strange rhythms coming through, so it was a normal what we call a normal sinus rhythm.
So then did you prepare the naloxone?
Yes.
And what was the reason for that treatment? We know it was mentioned to you by Ian Parsons.
Yes, so it was mentioned by Ian, the fact that he had pinpoint pupils, and with naloxone, there's no harm in giving it if we believe there is a drugs, which was mentioned at the time. It was believed that there was drug involvement.
In your statement, you refer to the area around the Sainsbury's car park being well known for drug users.
Yes.
So did that also influence your assessment of the possible cause?
Yes. So as part of our assessment, we always look at the environment as well, because it can be a big indicator as to what potentially could be going on.
And when you say look at the environment, did you look around for drug paraphernalia?
I had a very quick scout because it's part of our scene safety. We don't want to be kneeling on needles, sharp objects, etc. So as a very quick, in the immediate scene, I didn't notice any.
Do you also check for marks on the body to see if there's any indications?
Yes, so I believe I did that slightly later when I went to cannulate him. As a part of standard practice, when we go to cannulate a patient, we do check that there's no obvious track marks, because again, it is part of the patient care and safety of us and the patient.
And just before we come to the naloxone, did you consider the 1, 2, 3 plus training at the scene? Do you recall?
No, I don't recall. Sorry.
Did you think about the fact that there were 2 patients? Did that influence your consideration about what might be the cause?
Yes, the fact that there was 2 of them suffering, obviously it was in the back of my mind. that whatever has happened, potentially happened to both of them, and it could be the same cause, which kind of does help slightly narrow down the cause a little bit. It's
So we know you were thinking about a drug overdose potentially. Did any kind of poisoning enter your mind at that point?
other than food poisoning, because he was vomiting.
Yeah.
But, food poisoning shouldn't send somebody into a catatonic state. But other than that, nothing.
So not chemical poisoning?
Not in a million years would I have thought about chemical in Salisbury.
And just going back then to the naloxone, how did you prepare and administer that?
So with the naloxone, you draw it up out of the ampule, and you apply what's called a mucosal atomizer device, or an MAD, and you literally pop that on the end of the syringe, and then you insert it up the patient's nose and pull the plunger on the syringe.
You say in your statement, it's the end of page 3, I got the nurse to check that it was naloxone and confirm it was in
Yes.
date before I administered it.
Yes.
Can I ask you, is that the usual procedure when you administer naloxone?
For any drugs that we administer, there is a two-step check. So you check it yourself, and then you get somebody. Normally, it's a colleague, but obviously, I didn't have a colleague there, so I got the ICU nurse, who should be well versed in checking drugs, to check the drug before I gave it, just to make sure it's the one I want to give.
And what was the response, if any, of Sergei Skripal to that treatment?
I don't believe there was any immediate reaction.
So in your
I can't
statement, you
remember.
say, I think he appeared to respond by wincing slightly and drawing back.
Yes, that was it. Because it's quite a shoot up the nose with this, it will have elicited some sort of reaction. And bearing in mind he didn't respond to the painful stimuli, I was quite surprised when he sort of drew back ever so slightly from the spray up the nose. But with regards to drug interactions, there was no change in his output.
Thank you, that's what I wanted to ask you, thank you. And what did you do next? And we're moving to page 4 now. And a couple of paragraphs down.
So I believe I carried on with the monitoring, so blood pressure, which again I believe came back normal, and then I cannulated as a precaution, given the fact that the other patient was on the floor unconscious. There was a chance that I believe she was also shut down. I wasn't fully aware, but I vague memories of them.
So in case of deterioration?
Yeah.
Now, you'd indicated that he'd vomited. I think that was
Yes.
prior to the naloxone, was it?
Yes.
And did you cut off his coat?
Yes.
Was there anything unusual about the vomit at all?
Not that I can recall. It was a normal vomit.
And you do describe food
Yeah.
specifically chicken
Noodles.
and calamari.
Yeah.
And I think you said it was absolutely everywhere. Was there a lot of vomit?
Yes, there was a lot of vomit.
And then what happened at this stage? Was this when colleagues arrived?
Yes, I believe so. That's when Carl and Zoe arrived on a conveying vehicle, a DCA.
That was Carl Bullpit?
Bullpit and Zoe
Thomas?
Thomas. Yes, Thomas.
And what handover did you give to them?
It will have just been a very standard, what I had, as in the patient's symptoms and the observations. So his pulse, his etc.
I think you said in your statement you didn't have much information to give.
I literally didn't. I didn't have much to give them other than the fact that he was presenting very oddly, but stable, effectively. But I had no background of this patient. I didn't know who he was, where he'd come from. And normally that is covered in a handover. There's normally some sort of history that we can pass on, but I had nothing.
And just to clarify, Carl Bulpert, is that a paramedic?
Yes.
And
Yes,
Zoe
it was.
Thomas, an emergency care assistant?
Yes.
And what, if anything, did Carl suggest?
I believe he suggested that we got him onto the stretcher and onto the ambulance, I believe.
Did he suggest a nasal tube?
Oh, yes, sorry, beg your pardon. Yes, so he suggested that we upgrade the airway just in case, again, just in case he deteriorated. And I believe we popped in a nasal pharyngeal, which is a tube that goes up the nose and down the back of the throat.
And what, if any, response was there to that from Sturgess Skripal?
I
Have a look at your statements
Yeah.
if you need to remind yourself. We're on page 4, and nearer the bottom, the penultimate paragraph.
Oh yeah, when we okay, yes. Again, with I believe it was the same response as when I initially put the naloxone up his nose. It was a flinch.
So a little bit of a physical response
Mhm.
to treatments you're giving,
Yes.
but no change in the presentation
No.
otherwise.
No.
And did you then decide to move him to the ambulance?
Yes, I believe we did. Yes.
And can you just describe for us how you did that?
From memory and reading this, I believe we we manoeuvred him onto our stretcher. Obviously, he was a big chap, so it was very much a heavy lift. But I believe, if I remember rightly, we were expecting a heavy lift. However, it wasn't. It felt like he was holding his own weight, which again was a bit odd. But yeah, we literally just sort of manoeuvred him onto our stretcher. And made him comfortable on the stretcher.
I think you say you put him into ambulance 7710.
Yes, I believe so, yes.
And what did you do once he was in the ambulance? And this is the bottom of page 4 if you need to refer to it.
So yeah, once on the vehicle, we applied oxygen as just a precaution, especially as obviously we'd moved him as well, and we'd now put him in a lying position.
Was that on his side?
He was on his side initially, I believe, and then I think we moved him onto his back potentially. But initially he was on his side just in case he vomited again. I believe we removed his clothing as well.
And then it's going towards page 5 now. How did his presentation change when he was in the ambulance?
So I remember his jaw suddenly starting to clench down. Again, we weren't 100% sure why. And he started to make sort of groaning sounds, as if it was like as if he was in pain but couldn't tell us he was in pain. So yeah, but I believe that's all that changed. His outward observations still remained stable.
And you describe Carl beginning to try and put a cannula in his arm,
Yes.
and Zoe and you getting the OBS kit. Can you tell us what that contains?
So it's the same as what I had outside, but moving patients is really difficult with it all attached. So we unattached what we needed to, moved him onto the vehicle, and then reattached it. So it will be his oxygen, the SATS probe, which tells us the oxygen and pulse rate, the blood pressure cuff, and I believe we then again placed the ECG monitoring on him.
And is that when the critical care paramedics?
Yes, I
Attend.
believe at that point Rich Miller poked his head through the door and sort of asked how we were and what was going on.
And who gave him a handover?
I believe it was Carl. I believe Carl I don't recall talking to Rich at all. I remember being at Sergei's side, dealing with Sergei basically. Carl handed over.
Were you aware of Carl administering another dose of naloxone or anything else?
No, I couldn't tell you what he was doing. I was
So in your statement, you do say, I think Carl then administered another
Yeah.
dose of naloxone.
yeah.
I can't remember how.
No.
And you don't recall now.
No, sorry. No.
And did you then leave for Salisbury District Hospital?
Yes, yes.
Who was in the ambulance for that journey?
So Rich Miller joined us on our vehicle as the critical care paramedic. Carl and myself were also in the back with him.
And who was driving?
Zoe.
And what monitoring or treatment took place en route?
So all the same monitoring was done. An full ECG, I believe, was done, and SATs, pulse, all that sort of done. I believe at that point we also have found the time to do temperature and a blood glucose reading. And I believe because of the jaw clenching, I believe Rich gave then diazemals just to relax his jaw and his arms.
And the monitoring, was everything within normal parameters?
Yeah, I believe it was very odd. He remained effectively inwardly stable, but his presentation was actually very odd.
And what happened when you arrived at the hospital?
I believe we went straight into resus. As the previous crew, we'd given an Atmist. Again, that was Rich. Rich gave the Atmist.
Just explain what that is.
Sorry, that's it's basically a pre-alert to the hospital. It just tells them what's inbound, says that they can prepare teams, specialised teams, if that is required. So we arrived. They were expecting us because of his presentation, and I guess because of Yulia being unwell, our patient also went into resus.
Do you recall the doctor there when you attended? You refer in your statement to giving a handover to a consultant. You say you don't recall her name.
No, sorry.
Did you yourself give the handover or someone else?
No, it was Rich. I believe Rich and Carl gave the handover.
Do you remember what that was? Or
No, sorry.
And did you leave the hospital after that handover?
Yes.
You say in your statement that Des, an emergency care assistant and events officer who we've heard about, arrived at the hospital to give you and Ian Parsons the lift back to your cars, which were still on scene.
Yes, that's correct.
What happened to Sergei Skripal's clothes that you had cut off because of the vomit?
So I was told they had been double bagged because of the vomit and put in the back of my vehicle.
So what did you do with them subsequently?
So I removed everything from the vehicle, cleaned everything down, and placed Sergei's clothes at a particular place on the station. And I was told someone would come and pick them up.
Is that the station garage that
Yes,
we've heard about?
yes.
And I think you say in your statement you left the clothes in the clinical waste bags next to the
Yes.
vending machine in the garage.
Yeah.
And you said, I can't remember who, but a colleague said they disposed them for you.
Yes.
And did you then return to the ambulance station on Odstock Road?
Yes.
And what did you do there?
Sorry. So the garage that we were just referring to is on station.
Yep.
So it's at the bottom of the station. So once there, I had actually finished my shift at that point. So I helped clean the vehicle, handed over the vehicle to the person taking over from me, who also had helped clean all the kit. I then signed over all my drugs and went and got changed in the locker room.
Just to ask you about that, you describe in some detail in your witness statement cleaning your car boot and kit with antibacterial wipes. Is that normal procedure?
Yeah, for when you've been to a particularly grubby job, yeah, everything is cleaned to avoid cross-contamination.
And Had you been wearing gloves at the time
Yes.
when you treated
Yes.
Sturgess Ripple? Yes.
Yeah.
Or throughout?
Throughout the whole situation, I wear gloves.
And what happened to the clothing that you were wearing? And you deal with it at page 6 if you need to remind yourself.
So I still do it. I put it in a bag and I put it in my locker. Or if it's the end of my run of shifts, I will take that bag home and stick it straight in the washing machine.
And with reference to your statement, did you receive a phone call on Tuesday the 6th of March in the evening about your uniform?
Yes, I believe I did, yes.
And what were you told then?
I believe that was the phone call just to say to bag it and leave it out front house. I believe that was that one.
Have a look at your statement. It's just the second paragraph on page 6.
Page 6. So I did my night shift, and then Tuesday I took my straight washing machine. Yes, so they told me to put it in the washing machine at 60. That was right, which is what I did.
Had you already washed it by then?
I would have finished the Tuesday morning, wouldn't I? So yes, chances are I would have probably put it straight in the washing machine anyways.
And when and how did you find out that the Skripals had suffered nerve agent poisoning?
I can't recall. I got married 4 days after this incident, so my mind was very much on my big day.
Thank you.
So I do apologise. I don't remember when specifically I was told.
And I hate to ask the next question then, did you feel at all unwell after?
Not from this, no. No, not from this.
Hopefully not on.
Not
the wedding
physically.
day. Thank you. Can I just finally just ask you about training after the March incident?
Mm-hmm.
What, if any, training did you receive about dealing with suspected nerve agent poisoning?
So it was this. Well, obviously I was away after that for a little while, but when I came back, obviously I was made aware of emails and online training that had then subsequently been circulated.
So that had happened while you were away
Yeah.
for your wedding?
I believe so, yes.
And did it include recognition of the signs and symptoms?
Honestly, I couldn't tell you. It will have almost certainly included that.
And did you have an opportunity to see the evidence this morning of Mr. Parsons?
Sorry.
Were you
what?
here for the evidence of Ian
Oh,
Parsons
yes, sorry,
this morning?
yes.
And were you familiar with the duodote document that we had up on screen?
Yes, I have, yeah. I have
And
seen
were you
that.
familiar with that before March 2018?
It was available to me, and I had almost certainly read it when I first qualified as part of, your introduction to the trust. You work your way through the clinical guidelines. So I'll have almost certainly read it at that point, but it wouldn't have been recent, if that makes sense.
Do you recall seeing that after March when you came back from your period away?
Yes, they made it very clear after the March incident.
And a question we've heard this morning as well, were you given any guidance about the overlap of symptoms between opiate poisoning and nerve agent poisoning?
I don't recall any specific guidance, but it's very difficult to do that in the community setting. We don't have all the mod cons out there. We've literally got our basics. So a lot of conditions have overlapping symptoms.
So when that happens, what does your training say? Does it say to keep an open mind, assume it might be either?
Yes. So in those situations, you keep a very open mind, be prepared for what might come, and get them to hospital as quickly as possible, who do have the ways and means to further test.
And given your personal involvement, were you asked to take part in any training or learning dissemination after the incident, appreciating you were away for a period of time?
Nothing official. We had what I believe was a hot debrief with those involved in the incident, and obviously on station we all go through jobs that have been particularly big or could pose dangers to the rest of our colleagues. We obviously don't discuss patient details, but we do discuss these things in the crew room. That's how a lot of things are learnt. But that's just the way of medicine, unfortunately.
So is that informal discussion?
It's very, yeah.
You described the hot debrief. Does that mean the immediate aftermath,
Yes.
discussing what's
Yeah.
happened?
Yes.
And what's the purpose of that?
It's to discuss the job, discuss what went well, what we could improve on, and welfare. So making sure all that were involved are okay.
So is that an opportunity for managers to disseminate learning? Would senior people be there?
Senior people would be there, but it's more. Yes, there will be learning points if anything went particularly wrong, but it's not an official teaching moment, if that makes sense. It's not. It's more of a reflection as opposed to a teaching. I think. Does that make sense?
Yes, indeed. Thank you very much. Those are my questions for you. There may be a few more.
Thank you. Mansfield?
So, if I may, two only.
Of course.
Good morning. My name is Michael Mansfield. I represent the family of Dawn Sturgess.
Morning.
I just want to clarify one point in relation to your attention to the male patient in Salisbury. Your statement seems to suggest that the patient had administered 3 doses of naloxone. Is that right?
I'm not sure about 3. I know of 2. I gave 1, and Carl, I believe, gave a further dose in the vehicle.
Yes.
Sorry, off the back of speaking to the critical care paramedic who had been.
Yes. Well, you can look at the statement. I'm not going to take a lot of time over it. At the statement, the 5th page, at the top, the suggestion seems to be, from your recollection then, that one was administered by Rich, as you call him, when he popped his head round the door, and then another one actually en route to hospital.
Carl administered another dose of naloxone.
I can read the paragraphs if you want. I think Carl administered, you see it's a few lines down from the top of the page.
Yeah, so Carl administered naloxone.
And then, I
And
can't
then-
remember how and so on.
I believe
And-
Rich gave diazimals.
And then you've got driving to the hospital is the next paragraph.
Yeah.
All right, and then you seem to suggest there, I think
So-
Rich then administered another dose.
Yes.
So it looks as though there might have been 3 doses.
Potentially, but I couldn't say for certain because
No, it's all
I
right.
wasn't dealing with that. Sorry.
I'm not testing memory, it's all right. Question that arises out of these is when you got to the hospital, did you or somebody in the handover process indicate that the male patient had at least 2 naloxone administrations, which would tend to suggest not drugs?
As part of a normal handover, you would hand over what drugs were given. I wasn't part of the handover, so
All
I
right.
couldn't say for sure what was handed over,
But
but
you-
it should have been.
You would expect that to be part of the handover procedure.
Yes.
Right, one other question, and that is, once you came back into circulation, as it were, after these events, if I can put it that way,
Yes.
do you recall whether there was any training for frontliners like yourself, first responders, as to how you might distinguish between a nerve agent poisoning and an overdose of a drug?
So, I mean, as I said just a minute ago, it's very difficult to 100% rule out either or, because there are symptoms that match both. So there was no official training because I don't believe it's possible to completely rule out either.
Right.
In our particular setting.
So, can I just take it one stage further? If it's impossible to tell then what do you do if one of them might be nerve agent, which really requires extremely speedy treatment? I think you agree that. And you've got to get them to hospital and so on, and protection of the public and a lot of other ramifications. Was there any training or advice given to you about that situation?
There was no, not that I can recall, there was
No,
no
all right.
specific training for
Thank
that
you.
situation.
Yes, thanks very much.
Thank you, Mr. Mansfield. Is that the lot, Ms. Bartle?
Thank you, sir. Yes, I wonder if I could please adduce some witness statements of paramedics from whom we've heard reference by both witnesses today.
All right, just sit tight for the moment, Miss Wood.
Thank you.
Mrs. Wood.
First of all, Brendan McNamara, the student paramedic, his statement is INQ 005015, and that's dated the 11th of March 2018. And these are the witnesses, first of all, referred to by Ian Parsons. Claire Gurnett, INQ 004933, and that's a statement dated the 13th of March 2018, paramedic. And then Louise Cox, a critical care paramedic. The reference is INQ 004931, and that's a statement dated the 13th of March 2018. And Richard Miller, the critical care paramedic, INQ 004599, a statement dated the 13th of March 2018. And then Ms Wood has just referred to Carl Bullpitt, also a paramedic. The statement references INQ 004932, and that's a statement of the 11th of March 2018. And Zoe Thomas, an emergency care assistant. The statement is INQ 004962, and that statement is the 9th of March 2018. With your permission, sir, those will be adduced
Yes,
and
they should
published
be.
on the website.
Thank you very much indeed.
Thank you. So those are the witnesses for this morning. There are some preparations taking place for this afternoon, so I am asked whether it would be possible to take a lunch break until 1:45, please.
Yes, I should think so. Mrs. Wood, thank you very much indeed for coming. That's all that anybody has for you. There's no need to stay unless you particularly want to.
Okay.
You've no doubt got other things to do. Right. In that case, I'll adjourn until 1:45 was the suggestion, was it, Ms Whitelaw?
Thank you.
That's all right. We resume this afternoon, as I think you've probably already been warned, under the slightly different regime, which is designed to limit to the absolute minimum the risk of accidental disclosure of any classified information. I imagine that was you've heard about that this morning, but it means that when we resume, the people in this room will be limited to core participants, the witness, of course, their respective legal representatives, and nominated members of the press only. So spectators, to the extent that there are any, in the other room, please. They're welcome to listen there. And it also means, as I'm sure you understand, that there will be no electronic devices in this room except for those used for the official recording of what goes on. With that proviso, please, 1:45. Thank you.
All rise.